If you drink tea every single day, but you drink it plain, you may be missing out on something that has nothing to do with taste and everything to do with your manhood. In my urology clinic, I see hundreds of men in their 60s, 70s, and even 80s, and many of them tell me the same thing. Doctor, I've lost my strength. Doctor, my erections aren't what they used to be. And when I start asking simple questions about their daily habits, what they eat, how they sleep, what they drink, one small but very common mistake shows up again and again, especially when it comes to tea. Today, I want to talk to you about why, as a urologist, I strongly recommend never drinking tea without adding one simple thing. This isn't a pill, it's not a drug, and it's certainly not a miracle cure. But for many senior men, it can make a meaningful difference in blood flow, circulation, confidence, and erectile function. Stay with me because I'll explain this calmly, clearly, and in plain language. My name is Dr. Robert. I'm a board-certified urologist, and this is my channel, Health Spectrum. For more than 20 years, I've helped men deal with prostate issues, urinary problems, hormonal changes, and erectile dysfunction. And one of the most important lessons I've learned is this: small daily habits quietly shape your health over time. What you drink every day matters, not just for your heart or energy, but also for your sexual health. Now, let's speak honestly for a moment. As men get older, erections often change. They may not be as firm. They may take longer. Sometimes they're less reliable. This is not a personal failure. It's not weakness. It's biology. An erection is not just a sexual response. It is, first and foremost, a blood flow event. Healthy erections require open blood vessels, flexible arteries, responsive nerves, and adequate nitric oxide. As we age, blood vessels naturally stiffen, circulation slows, inflammation increases, and hormone levels gradually decline. All of this affects erectile quality. This is why lifestyle habits matter even more after age 60. Now let's talk about tea. Many seniors already drink tea every day. Green tea, black tea, herbal teas. That's a good habit. Tea is rich in antioxidants. It supports heart health. It helps fight oxidative stress. All of that is beneficial. But here's what most men don't realize. Tea by itself is incomplete. In fact, when you drink tea without one specific addition, you're not getting the full benefit your body is capable of using, especially when it comes to circulation and blood vessel health. Most men drink tea plain, or worse, with sugar, and excess sugar works directly against erectile health by damaging blood vessels and increasing insulin resistance. But there is one simple, natural addition that can dramatically improve how your body responds to tea. That addition is fresh lemon. As a urologist, I recommend that senior men never drink tea without adding lemon, especially if erectile strength and circulation matter to you. Now let me explain why this works. Tea contains powerful compounds called polyphenols and catechins. These are excellent antioxidants, but many of them are fragile and poorly absorbed on their own. Vitamin C, which is abundant in lemon, helps stabilize these compounds and significantly improves their absorption in the body. In simple terms, lemon helps your body actually use what's already in the tea. But that's just the beginning. Lemon also contains natural plant compounds called flavonoids. Some of these flavonoids support nitric oxide production. Nitric oxide is one of the most important molecules involved in erections. It helps blood vessels relax and widen, allowing blood to flow into penile tissue more effectively. Without sufficient nitric oxide, erections become weaker and less sustainable. As men age, nitric oxide production naturally declines. That's why supporting it through diet and daily habits becomes so important. Lemon, combined with tea, helps support the lining of your blood vessels, known as the endothelium. A healthy endothelium means better vessel flexibility, smoother blood flow, and improved circulation throughout the body, including the pelvis. Another important factor is inflammation. Chronic low-grade inflammation is extremely common in older adults. It damages blood vessels, interferes with nerve signaling, and contributes to erectile dysfunction. The antioxidants in tea, when enhanced by lemon, work together to calm inflammation and reduce oxidative stress. This is especially important after 60, because the margin for error becomes smaller. Younger men can get away with poor habits. Older men cannot. Every choice either supports circulation or slowly works against it. Now, I want to be very clear. Lemon tea is not a miracle cure. I am not claiming it will instantly fix erectile dysfunction. But in my clinical experience, men who consistently adopt circulation-supporting habits often report noticeable improvements over time. Some tell me they begin experiencing stronger morning erections. Others say firmness improves. Many report better responsiveness and improved confidence. And confidence itself plays a significant role in sexual health. So, how should you drink tea properly as a senior man? Choose green or black tea if possible. Add the juice from about half a fresh lemon. Avoid sugar. If you need a little flavor, a small amount of cinnamon or a tiny bit of honey is a better choice. Drink it warm, not extremely hot. And the best time to drink it is in the morning or early afternoon, not late at night. Avoid pairing tea with heavy, processed meals, and try not to drink it with artificial sweeteners, which may negatively affect vascular health. Some men ask me if they can add ginger. In small amounts, yes, ginger may further support circulation. But keep it simple. Lemon alone already makes a meaningful difference. Now let me offer an important reminder. This is not medication. This is not a replacement for medical treatment. If you have diabetes, heart disease, or prostate cancer, or if you're taking prescription medications, always speak with your doctor. However, for most seniors, this is a gentle, safe daily habit that supports overall vascular and metabolic health. And remember this, erections are not just about sex. They are about vitality, confidence, connection, and self-respect. They reflect how well blood flows through your body. And you deserve to feel strong and capable at any age. So remember what I said at the beginning. If you drink tea every day, never drink it without lemon, especially after 60. If you found this helpful, please like the video and subscribe to Health Spectrum for honest, senior-friendly medical guidance. And if you'd like, leave a comment below saying, I drink tea with lemon now. Your health matters. Your confidence matters. And age does not disqualify you from vitality. Now, let me go a little deeper, because many of you listening may be wondering something important. You may be thinking, Doctor, I already drink tea. I've been drinking it my whole life. Why would something as small as lemon suddenly matter now? That's a fair question, and the answer lies in how the body changes with age. When you were younger, your blood vessels were naturally more flexible. Your nitric oxide levels were higher. Your hormones were more forgiving. Your body could compensate for small nutritional gaps without you even noticing. But as the years pass, those natural buffers slowly fade. After 60, the body becomes less efficient at extracting and utilizing nutrients. This means that even healthy foods and drinks may not deliver the same benefit unless they are consumed in a way that improves absorption and efficiency. That's exactly where the combination of tea and lemon becomes important. You see, erectile function depends heavily on the health of very small blood vessels. These vessels are much smaller than the ones supplying your heart or brain. That means they are often the first to show signs of trouble when circulation is compromised. This is why erectile dysfunction is sometimes an early warning sign of vascular aging. In fact, in modern medicine, we often say that erectile dysfunction is not just a bedroom issue, it's a whole body issue. It reflects what's happening inside your blood vessels. When I speak with men in my office, many of them blame age alone. They say, Doctor, I'm old. This is just how it is now. And while age does play a role, I want you to hear this clearly. Aging does not mean shutting down. It means adapting more intelligently. Daily habits matter more now than ever. Let's talk briefly about something many seniors overlook. Consistency. Improving circulation does not depend on doing something dramatic once in a while. It depends on small supportive actions repeated daily. Drinking tea with lemon is not powerful because it's extreme. It's powerful because it's gentle, repeatable, and sustainable. Another aspect worth mentioning is hydration. Many older adults are mildly dehydrated without realizing it. Even slight dehydration thickens the blood, reduces circulation efficiency, and stresses blood vessels. Tea with lemon can encourage better hydration habits, especially for men who don't enjoy drinking plain water. Now, some of you may be wondering if bottled lemon juice works. As a physician, I recommend fresh lemon whenever possible. Bottled lemon juice often contains preservatives and lacks some of the active plant compounds. Found in fresh citrus, squeezing half a lemon takes just a moment, and over time, that simple habit can add up. I'd also like to address something very important: expectations. You may hear exaggerated claims online promising overnight transformations. That's not how the body works, especially in later years. What you should expect instead is gradual support, over weeks and months. Improved circulation habits often lead to better responsiveness, improved stamina, and greater comfort in intimacy. And intimacy itself deserves respect in this conversation. Many seniors feel embarrassed discussing sexual health. But intimacy is a normal, healthy aspect of life at every adult age. It supports emotional connection, mental well-being, and self-esteem. When erections decline, it's not just a physical issue. It can quietly affect confidence and relationships. That's why I prefer solutions that empower men without shame. Simple nutritional habits give you something positive to focus on, rather than something to hide or be embarrassed about. Let me also address medications. Many common drugs prescribed later in life, blood pressure medications, antidepressants, prostate treatments, can influence erectile function. If this applies to you, do not stop any medication on your own. But understand this: supporting circulation nutritionally can still be beneficial, even when medications are necessary. In fact, many physicians encourage lifestyle measures alongside medical treatment. It's never an either-or situation. It's about supporting the body from multiple angles. Now, I want to talk briefly about something related but often ignored: stress. Chronic stress tightens blood vessels. It increases cortisol. It interferes with hormone balance. Seniors may experience stress from health concerns, finances, family changes, or loss. Tea itself has calming properties, especially green tea. Adding lemon can enhance the ritual, turning tea time into a moment of calm, which indirectly supports vascular health. Never underestimate the power of a calming routine. Some men also ask me whether they should drink lemon tea once or multiple times a day. For most seniors, 1 to 2 cups per day is sufficient. More than that is not necessary. And excessive tea late in the day may interfere with sleep due to caffeine content. Sleep, by the way, is another critical piece of the erectile health puzzle. Testosterone production occurs largely during deep sleep. Poor sleep quality weakens erections over time. So, drink your tea earlier in the day and protect your sleep at night. Now, there's a reason I emphasize gentle daily habits on this channel. The goal is not to chase youth. The goal is to preserve function, dignity, and quality of life. Aging well is about maintaining what matters. Erectile health is not about performance alone. It's about how alive you feel in your own body. It's about confidence when you look in the mirror. It's about closeness with a partner. And yes, it's about circulation, blood flow, and cellular health. One of the most encouraging things I see in my practice is how responsive the body can still be, even later in life when it receives consistent support. The human body has an incredible capacity to adapt, but it needs the right signals. Tea with lemon is one of those small signals. It says to your body, we're supporting circulation. We're reducing oxidative stress. We're paying attention. Now let me speak directly to the men who may feel discouraged. If you've struggled with erectile issues for years, I understand how frustrating that can be, but do not underestimate the impact of steady, supportive changes. Many improvements come not from one dramatic intervention, but from many small ones quietly working together. Nutrition, hydration, movement, sleep, stress management, and mindset. All of these influence vascular health. Lemon tea fits beautifully into that picture. I also want to say this clearly. This advice is not about selling you anything. There's no supplement here, no product, no hidden agenda. This is about empowering you with knowledge so you can make informed, simple choices. As a urologist, my role is not just to prescribe treatments, but to educate. And education is most powerful when it's practical. So let me summarize this in plain language. Tea is good for you. Lemon makes it better. Together they support blood vessels, circulation, antioxidant activity, and nitric oxide, the very foundations of erectile health. Is it a cure? No. Is it helpful? For many men, absolutely. Is it safe for most seniors? Yes, when consumed responsibly. And most importantly, is it something you can do consistently without stress? Yes. That's why I recommend it. Now, before we close, I want to remind you of something deeply important. Your value does not depend on perfect health or perfect performance. You are worthy of care, respect, and vitality at every stage of life. Taking small steps toward better health is not vanity. It's self-respect. If you've made it this far, I encourage you to try this habit for the next few weeks. Pay attention to how you feel, not just physically but mentally and emotionally. Often, when circulation improves, energy and confidence follow. And finally, I want to thank you for being here. Channels like Health Spectrum exist because seniors deserve honest, calm, respectful health information without fear, hype, or embarrassment. If you found this helpful, please support the channel by liking the video and subscribing. And if you feel comfortable, leave a comment sharing your experience. Many men silently struggle, and your comment could help someone else feel less alone. As always, take care of yourself. Drink your tea, add the lemon. And remember, vitality does not expire with age. Your health matters. Your confidence matters. And it's never too late to support your body wisely.